Welcome to the voyage, the trials, transitions, and triumph. This is not a podcast about perfections, it's a space for real conversations about the journeys we don't always post or talk about, the trials that shape us, the transitions that stretch us, and the triumph that quietly redefine who we become. Today's podcast is not one thing that so many people want to talk about or know that they actually need because we are talking about the brain. Yeah, right there. The place where fear begins, where memory lives, where trauma hides, and where life itself is interpreted. My guest today is Dr. Emmanuel Nwozo. You are welcome. He's a consultant neurologist at the Benue State University Teaching Hospital in Makurdi, Nigeria, and he's also the Secretary General of the Nigerian Society of Neurological Sciences. He works daily with conditions that many people fear but don't fully understand: stroke, epilepsy, dementia, chronic headaches, and other neurological disorders. See, but this conversation today is not a medical lecture, it is a human one. Because we're going to talk about the signs people ignore until it is too late, the myths that silently harm families, the lifestyle and habits we normalize that slowly cost us our health, and what it means to sit with patients and families at their most vulnerable moment. If you have ever worried about your own health, or care for someone who was struggling, or simply wondered how modern life is shaping our mind, this conversation is for you. Take a breath, lean in. This is the voyage, and let's have a good time together. You are welcome to the voyage today. And today is going to be an exciting and interesting session today. In the house, I have an important guest. By the name is a consultant neurologist, and his name is Dr. Emmanuel Nwozo. You are welcome, sir.
Thank you. It's my pleasure to be here.
Well, so this is one of those opportunities where I try to make sure that when I have an opportunity to meet people that can contribute and leave a lasting impression on this YouTube channel, I try to engage them so that we use every opportunity to educate people, to inspire people. Like I said, that in life we all go through different seasons of life, either a season of triumph, a season of transition, or a season of triumph. So it's a pleasure to have you on the show. Before we get into the gist of the podcast today, let's get to meet you. Can you please introduce yourself, sir?
So thank you very much. It's my pleasure, and thank you, listeners out there. I'm Dr. Emmanuel Nwozo. I currently practice as a neurologist at the Benue State University Teaching Hospital. I am the head of neurology unit. Also the head of department of internal medicine department, and doubles as a lecturer in medicine department, College of Health Sciences at the Benue State University. Currently has been renamed as Reverend Father Moses Oshua Dasu University in Makurdi, Benue State, Nigeria.
Interesting. So definitely we are here in the US today. So what brought you to the US? Let's start from there.
My coming to US is a long story, but I think I won't give all the details.
Yeah.
Here on a visit, equally also in the course of that visit to see research partners. I do some research, a lot of research, and one of the research is part of African Dementia Consortium, which is working on dementia in Africans. That study cuts across about 11 African countries, which Nigeria is part of. And in Nigeria, about 12 or 13 institutions in Nigeria And incidentally, in my institution, the Benue State University Teaching Hospital, I happen to be the site PI. So that's why I'm here.
So you are an authority when it comes to the issue of brain. We can say that,
Yes,
right?
yeah, by God's grace.
I'm interested in that research work. If you have time, we'll delve into it. But let's maximize our time and begin to talk about the brain. But before we get into that, I'm curious, what moment in life did you first realize that the brain and not the heart controls almost everything we call life?
All right. Maybe that would take me to what actually, because I can't be talking about the brain neurology without talking about the experience I had long ago as a medical student. Now, while I was in school, and it's interesting to know God, it's interesting to follow God, it's interesting to desire to know what is God's will and God's way for a man's life. Right early in medical school, I remember at the point of graduation, we had this yearbook and we were interviewed like this. And part of the interview then, they asked me, what are you seeing in the years ahead? And I said, what I sense God will want me to be, number one, I will be I will be a physician, that's internal medicine. And I will also be a preacher. So I will combine two things together.
Interesting.
I will be a preacher and I will be a physician. And both of them, I think God will want me to do it together. I didn't know that it would be in neurology specifically, right? So I got into residency. I did my residency at Ahmadu Bello University Teaching Hospital in Zaria in northwest Nigeria. And in the course of my residency has two phases. The initial phase, and in that phase, by the time I started doing neurology, I was thrilled by, and incidentally, I had these teachers who made neurology very, very simple. Because way back then, in the university as undergraduate, neurology, we saw it as something very difficult, something very, if I use the word, like a mystery. But by the time I started residency, I saw, this was quite interesting. This was quite, so that was what endeared me to neurology. Even though after my training, first section of the training as a junior resident, I passed that exams, and I was now to specialize. It was at this point of specialization you can now decide where to go into. I had many reasons also not to go to neurology, even though initially, because of the simplification of the subject, I had interest in it. But many other things made it. One was that the work was quite demanding. A lot of patients. In fact, then in our hospital, neurology has almost 40% of the patients, where you have almost 7 specialties. Just one specialty had like 40% of the inpatients. So the work was quite tasking. Secondly, my training will also demand my leaving my station, because in my institution then we didn't have accreditation. So that will means my going to another station entirely, another part of the country to train. So these were reasons why I shouldn't even have chosen neurology. But by and by, I sensed that was what God would have me do. And that's where I'm here today as a neurologist.
So your choosing the path of neurology was a decision not motivated by money?
Not at all.
But a decision motivated by following the leading and the guidance of God. Why is that important to you?
Yes, by God's grace, maybe I will also go back a little. I became born again. I came to know Jesus as my Lord and Savior way back in secondary school. I think in my JSS2.
Really?
Yes. All right. So that relationship with Jesus has grown over time. And also a privilege while I was in school and the university as an undergraduate. God helped me to grow in that relationship to the point that I occupy several leadership positions. Our fellowship then, I remember, I became the national president of the fellowship way back in our nation. And so I had this relationship with Jesus that I felt following him, obeying him, seeking to know his will and doing his will must be my primary consideration. So by the time I was finishing university, it was obvious God will have me be an internist and a physician, internal medicine. But specifically where it was, I didn't know. But by the time I came over during the training, like I said, meeting this trainer who simplified neurology, secondly also praying and seeing that this is where God will have me be. I felt this is where God really had me be. So money was secondary. Money was not even part of it at all. So my first consideration was that I sensed this is where God will have me be. And even when there were obvious hindrances, impediments, reasons why I should not choose that specialty, I sense God will have me choose that specialty. And maybe to just point that even my colleagues who felt like going to the other specialties, some very to the glory of God, I finished neurology in record time. Really? I went outside my station for almost 1 year, and by the time I was going for part 2 exams, several of them had not even were not ready to finish the program. So I saw God's hand in it. Now, when God leads a man through a path and you follow God, considering to do His will, He makes the journey very, very smooth. And that was my own experience.
So you are saying that because of you following the guidance and the leading of the Lord, there have not been any challenges or difficulties along your path?
There have been a lot of challenges also. There have been challenges, yes. For instance, in the course of my training, like I said, my primary training was in University of Ahmadu Bello University Teaching Hospital. I had to go all the way to University College Hospital, Ibadan, Oyo State, southwest Nigeria, from northwest Nigeria to southwest Nigeria. That's almost 12, 13 hours journey. And I was married by this time. I had children. I had to leave my family way back in Zaria and move over to Ibadan for 1 full year. And it wasn't easy. At this time, my wife was, I think one of the times she was even pregnant. At a point in time, one of our children was sick, in and out of hospital. So obviously there were challenges there, but God was there. God was gracious and He saw us through. And today all that is a testimony and a past story.
Before we talk about the science of the brain, I am still interested about the fact that you're choosing the field of neurology in medicine and even still working in that field now. You are not motivated by money or by position and things like that. And we are in a season, or what is common right now is that many of the medical professionals in Nigeria are seeking for better opportunities outside of the country. Why is it that none of this matters to you, to seek for greener pasture, but rather stay back in Nigeria practicing as a consultant neurologist?
All right, that's a very important question. The temptation to migrate has been there, but one of the things that has kept us, and we are glad we are there, one of the things that has kept us is this issue of God's will. We prayed about it. I remember one of the times a colleague called me and said, Dr. Iwozo, there's an opportunity for Saudi. Can I share it with you? And the pay is very, very good. How many million? That will change your life. That will change. And I was with my wife, and I just laughed and laughed and laughed. And she said, why are you laughing over this serious matter? My wife just turned and said, oh, don't you know Dr. Iwozo? Dr. Iwozo cannot move anywhere if God has not asked him to.
Wow.
And I simply say, thank you for your concern. We'll pray about it. And we prayed, and we sense God is not saying yes. So one of the things God has taught me over time is the fact that the life of a man does not consist in the abundance of the thing that he possesses.
Really?
Yeah.
But that is contrary to the norms in our society.
Yes. God's ways, just like the Bible says, as the heaven is higher than the earth, so is His ways than our ways. I've come to, since, like I said, one of the things that the turning point in my own life is coming to know Jesus. And not just coming to know Jesus, in the course of our life journey also, we came in contact with discipleship, the teaching of the Word of God that makes it important that in everything we do, we must seek to find His way, His will in it. All right. So, having come to that understanding, it becomes difficult to just take a sporadic decision to migrate, to move just because of money. The first consideration is, what is the will of God over this? And we have prayed men in such opportunities, and we didn't see God saying move. And so long as we have not seen God say move, that is why we have not moved, and we are happy where we are. And by God's grace, where we are, maybe we'll talk much more about that. Apart from our practice, we're also doing several things, whether among the students, whether among couples, whether among different calibers of people. And we are glad that God has positioned us in times like this to do all this.
It is much more important to you to follow whatever God tells you rather than to seek for a greener pasture.
That is the truth of it. That greener pastures may be good, but for now, we have not seen God saying, He was Emmanuel, or He was leave. We have not seen God saying, this is where I want you to be. In fact, the location where we are in now, very clearly too, by the time we finished our training in residency, we were praying and said, Lord, where will you have us be? Incidentally, I'm not from that state. I trained in Zaria. I'm from Imo State, from the east. I trained in the north, in Zaria. And by the time we concluded our training, we were praying and we were saying, Lord, where will you have us be? And the options were, go to Abuja, go to Akwa Ibom. Akwa Ibom was happening then because an oil producing state, a lot of opportunities were there. But we kept praying and we heard God say, go to Makurdi. And the way we got even the job was also another story for another day. But we sense where we are now is where God will have us be. We have not had a contrary leading to live where we are now, and that's why we have not moved.
Has there been reason or incident that will make you to doubt if you actually heard God well?
Yes, many.
Can you share one?
Okay, I will share one of them, which was very striking. But again, we are not surprised because by the time we were moving where we are, Zaria to Makurdi, where we reside currently, one of the words God gave us was in 1 Corinthians 16, verse 9. He said, I have set before you an open door, but there are many adversaries. All right. So the first experience we had was when we came to Makurdi, the environment was not welcoming. All right. Wasn't welcoming in several respects, in several ways. I won't go into details. But while we're there, 2019, I think 2020, COVID came up. And in fact, before then, I was working in the Federal Medical Center, which was a tertiary federal government hospital. And we had a leading also that, look, where I was, I didn't think I was productive, not in terms of patient care. I had a lot of patients I was seeing. By the time I came here, there was no neurology clinic. I had started one. By the time I came here, they had EEG, electroencephalography machine that had been moribund for almost 3-4 years. We resuscitated it, and up to today is working at ensuring that patient care, EEG is being done for patients. But while I was there, there was no residency program. There was no medical student program. And I felt not satisfied. I sensed that, look, I wasn't impactful. I felt I wasn't replicating myself. I felt I wasn't affecting younger lives. And so we had a leading to move to the university where I will have opportunity to train residents, where I will have opportunity to also train students. So I moved to the university and to the teaching hospital. Now, that happened in 2019. By 2020, early 2020, COVID broke out, I think March. Incidentally, in our state where I reside, in fact, I think in the whole state, I was the second victim of COVID.
Really?
All right. Now, it could have been, it was, how come? You said God asked you to move from Federal Medical Center to the Benue State University Teaching Hospital, and within less than 6 months, or be 8 months of coming in here, you're affected by COVID. Not only was I affected by the
Wow.
COVID, in fact, the day I was diagnosed to have COVID, the second person in the state, it was myself, my wife, and our first son.
Really?
So the three of us were taken into isolation. As if that was not enough, we are a family of 7, myself, my wife, and 5 children. Now, while I, myself, my wife, and our son was there, they went to screen again and realized that the other 4 children in the house, all of them had COVID.
What?
So the whole family, myself, my wife, and the 5 children were together in the isolation ward. Yes. That was like a dark moment. It was as if everything has collapsed. It was as if the world has ended. It was as if we're not going to make it. We're there for over, I think, almost 28 days before we came out of isolation ward. But to God be the glory, we're fine. Nothing happened, no complications. We came out fine. And so being even in God's will is not without challenges, is not without difficulties, is not without trials. But one thing that is sure, even in the midst of those trials, God will cause you to triumph. And that has been our story and has kept us going.
That is amazing. Now, let's talk about the science of the brain. Everybody is searching online about why younger people seems to be having stroke in their 30s and 40s. What is causing that?
All right. Now, there's what we call stroke in the young. Stroke in the young is simply stroke that occurs in young people. And depending whether you are using the American or the UK, generally we say 50 years. So when people have stroke below 50 years, it's stroke in the young. Yeah, generally it's believed that stroke should occur in older people, those above 50. But there are things that commonly will cause stroke in the young. One, when people have stroke in the young, we should look at the heart. So several times there may be an issue with the heart, a pathology in the heart. All right. Few other times, connective tissue diseases. People that have systemic lupus erythematosus and other connective tissue diseases could be responsible. People that have infections, HIV can be a risk factor for stroke in the young. Few occasions, substance abuse, cocaine, amphetamine, methamphetamine, all these are risk factors for stroke in the young, including even migraine, okay, and few other conditions, what we call Moya-Moya syndrome, and few other conditions that are big medical jargons, which I don't want to go into. So many times this, and in our time also, a lot of demographic transition. Under activity, a lot of people work from home, even young people. So you see a lot of young people are obese now because they are no longer active, they work from home. A lot of young people, because of obesity, also are developing hypertension in early age. A lot of young people also are developing diabetes because of diets, high cholesterol. So all these are things that fuel even young people having stroke. So things that naturally causes stroke in the elderly people, we are seeing them also causing stroke even in younger populations now.
So in that regard, what are some of the earliest signs of stroke that people usually ignore?
Yeah.
Either among the young or the old?
Yeah. Generally, there's an acronym that is used by whether the American Stroke Association, and it's globally acceptable. What is the acronym FAST? FAST stands for F is facial asymmetry. So when people have stroke, few of the warning signs could be early facial asymmetry. That means their face can be contorted. I mean, there could be a change in their face. So their face could be pulled to one side. So that could be an early warning sign. Also, A could be aphasia. They could have with their speech, right? They could also have issues with weakness of the arm, all right, arm weakness, leg weakness, and speech or language difficulty. So they may have problem with expressing themselves. They may have problem with weakness of the limb, which will make it difficult for them to walk. So these are cardinal features that people with stroke could have. So when people have this, in developed countries like here, they will say they should call 911, right, so that they can get to the hospital, because it's also important. Stroke is a medical emergency. When patients with stroke present early, the outcome is far, far better than when they present late. So we say normally that time is brain, all right? So the more time that is wasted, the more complication that could ensue from the stroke.
So talking about the issue of time then, what should people do in the first 10 minutes when they realize that they're having symptoms of stroke before they get to the hospital? What can they do?
Yeah, like I said, getting to hospital is very important. But in the immediate period, few things that can be done at home, because somebody who has had a stroke could actually fall, all right? And the fall could complicate it. So somebody who have a stroke may be attempting to move, and may fall and have head injury on top of the stroke that has already happened. And many times that can complicate it, because the person now maybe had ischemic stroke where there's a blockade of the vessel, and the falling down bleeds into the brain. So two things are now happening. So patient may not even require surgery to even handle the bleeding into the brain aside the infarction or ischemic stroke that has happened. So when people have a stroke, one of the things that should be done, get them to lie down, get them to sit down, let them not be moving. Okay. If you need to also check, because sometimes people have a stroke, you want to force feed them, you want them to eat at all cost. It's not a time to force them, because stroke can affect also the swallowing. So when you force them to feed at that point, they could choke. Okay, they could aspirate. Things could go into their lungs and cause aspiration pneumonia. So it's important that when people have had a stroke, all these things to be avoided. Let them sit down. Don't force them to feed. It's not a time to force them to drink water. Do everything possible to get them to the hospital as quick as possible.
Thank you. So what is one daily habit that quietly increases the risk of stroke that people don't usually know?
Yeah, now there are few things, you see, generally all over the world, the commonest risk factor for stroke is hypertension.
Okay.
All right. So now there are some habits that, even though hypertension could have a genetic basis for happening, but also some things also worsens it. All right. So inactivity, diets laden with so much cholesterol, all right, sedentary lifestyle, and in our time also people smoke, people drink. All this fuels, in fact, hardens the vessels and makes hypertension much more likely. And hypertension is a common risk factor for stroke. So I think these are lifestyle issues that must be contained in order to even prevent people from developing stroke.
Is there any particular diet or food that people ignore that easily contribute to people having stroke?
Yes. Now, we talk about dietary approach, what we call DASH diet.
Okay.
Dietary approach to stop hypertension. Like I said, hypertension is common risk factor for stroke. So, all right. So, we advise diet that has less cholesterol, diet that has a lot of fruits, diet that has low sodium.
Okay.
All right. Diet that has a lot of vegetables. Okay. In its place, instead of sodium, now we talk about even potassium. All right. So all this helps to reduce the likelihood of hypertension and invariably the likelihood of people developing stroke. So
what about all of this fast food?
So that's where fast food is. Fast food. What drives fast food? Fast food had a lot of salt. They put so much salt laden with Maggi and several of those seasonings. So there's a lot of salt. Fast food has a lot of cholesterol.
Really?
Yes.
So people that are eating or people that are addicted to fast food, they are much more susceptible to hypertension and to stroke.
Yes, because salt, high salt there high cholesterol, and all these are risk factors for hypertension, risk factors for stroke. So fast food, we generally advise people, you can cook your food, take things that are natural, more vegetables, fruits, less cholesterol, less salt. It's very, very important.
Now, let's talk a little bit about something different.
All right.
Let's talk about breaking the fear and the stigma around epilepsy. Why is it that epilepsy is surrounded by fear, shame, and in fact, some people will say there is a spiritual dimension to it?
All right. Now, epilepsy is also another common neurological problem. Globally, it's said to be about 70 million people globally have epilepsy.
70 million?
Yes,
What?
globally. Even though almost 70% of that is in sub-Saharan Africa. All right. That's where I practice. Nigeria is in sub-Saharan Africa. WHO several years ago talked about bringing epilepsy out of the shadows. And what is that about? Is that there's a lot of stigma, a lot of discrimination associated with epilepsy. So even people who have epilepsy, all right, or who have children or relations with epilepsy, they want to keep it out. They want to hide it. They don't want people to know. And many times that is also what makes them even not to come to health facilities where they can be helped. Because incidentally also, even though epilepsy is a common neurological problem, about 70% again of people with epilepsy with proper drug can be controlled. They
Controlled or
Yes.
cured?
All right. We use the word controlled
Okay.
because with proper drug, that repeated episode of unpredictable seizures can be controlled, can be contained. And a lot of them under 2 years may not even have seizures again. All right. But the challenge is that a lot of people who have epilepsy don't even present to health facilities, don't even come to hospital. All right. Rather, they have several things they say is the problem. In Nigeria or in Africa, and I think it's a global problem anyway, because if you look at studies from other parts of the world, whether China, whether India, all parts of Africa, you will see that they term epilepsy to be different things. But let me talk about Nigeria, where I practice. All right. Sometimes they say it's a spiritual attack.
Okay.
All right. Sometimes some manifest in a way that some people say, oh, the person is mad. Okay. Sometimes they say the person is possessed by an evil spirit. So they get exorcists to cast out that evil spirit. But generally, epilepsy is a neurological problem, and it can actually be treated. And with treatment,
It is a neurological problem.
yes, it's a problem that affects the brain. In epilepsy, what exactly happens?
Okay.
There is abnormal, excessive electrical discharges in the brain. So now depends on which part of the brain that abnormal electrical activities are emanating from. If it is part of the brain that controls motor activity, that means movement, the person can jerk and fall. It is part of the brain that controls behavior. The patient can behave abnormally. All right. I remember I had a patient, a 21-year-old lady who has epilepsy, and she suddenly got her clothes, got her credentials, and got them out of the house and burnt them. All right.
Really?
Yes, during one of those episodes.
Wow.
So it can make people even behave in a manner that you may think they have psychosis, they have mental illness, but epilepsy can manifest that way. So it can manifest with behavioral symptoms, can manifest with motor, can manifest with even sensory. So patient with epilepsy can complain of pains and abnormal sensation, headaches, and all that. So it depends on the part of the brain where that abnormal, excessive electrical discharges is emanating from. That determines how the patients with epilepsy present.
What causes these excessive electric discharges?
All right. Now, we now talk about risk factors for epilepsy.
Okay.
All right. Now, it depends on where. Again, where I practice in Nigeria, in Africa, one of the problems we have, a lot of people have issues during pregnancy, there's poor antenatal care or even no antenatal care. During the birth process, a lot of people still deliver at home or with their pregnancy, birth unattended to. Some deliver in mushroom places where there are no trained midwives or doctors to attend to the labor, and so sometimes the labors are prolonged. Sometimes these children are born and they suffer birth asphyxia. They come out not crying, they are blue. So that is already a problem that child might develop epilepsy tomorrow. Sometimes people have meningitis, have encephalitis. In our environment also, a lot of head injury, all right? Road crashes, whether from vehicle accident. Also in our country, there's a lot of bike, motorcycle that rides, and they don't use helmet. So many times this causes road crashes and head injuries. So many of these persons eventually can develop epilepsy tomorrow. Because what happens with any of these events, it leaves a scar in the brain. So that scar causes abnormal electrical discharges.
Wow.
So that's actually what happens. So any of this mechanism of injury will cause a scar in the brain. So that scar becomes a nidus, becomes a focus for abnormal electrical activities in the brain.
Growing up,
yes,
you see, in fact, you want to run away from people that have this episode of epilepsy.
Yeah.
That is what I see people around me do. And so growing up too, when I see somebody, because it is strange, it is abnormal, and you are scared and you just want to run away. And what I usually see is that they will put spoon into their mouth. So my question here is that what should people do when they see somebody having an episode of epilepsy?
All right. So like you have said, epilepsy is usually unpredictable. Okay. So when people have epilepsy, I want the public to know that one, epilepsy is not contagious.
Okay.
All right. Saliva from them will not make you have it.
Okay.
In some places, a lot of myths about epilepsy, that if you're a pregnant woman, you see somebody who is convulsing, that will run away because your baby will get epilepsy. No, it's not contagious. It's not contracted that way. So when people have that kind of problem, they need help. They need to be assisted. All right. So putting spoon in their mouth also is not advisable because
Really?
because sometimes that can actually even cause problem with their teeth. That can cause the teeth to break and all that. Right, that can cause injury to the tongue, injury to the teeth. So when people have epilepsy, just like we have said, one of the things to do is to get them. Many times there may not be drugs immediately to give them in the environment where it happens, except it's in the hospital. So one of the things to do is to get them to lie down in a very quiet place, free from objects that will cause injury to them. Can pull their clothing so that they can have some fresh air, right? If there are secretions in their mouth, if you have gloves, you can help remove it. Just lie them quietly. As much as possible, we also said you should lie them on the what we call left lateral position. That means put their head to the left. That way, even secretions will not likely enter into their lungs, unlike if you put it to the right, where it's easy for those secretions to enter into their lungs. So I think that's what to do basically. But several of those practices, putting spoon in their mouth, in some places they go as far as even pouring oil into their mouth, all those can cause more problem than good for patients who have epilepsy.
Okay. To move to completely something different.
All right.
I am fascinated by the human brain. And I'm curious, is there a difference between the brain in a black man and the brain in a white person?